So based off your pelvic exam and your biopsy, it does seem that you do have endometrial cancer.
Oh no.
Yeah, but no need to worry because there's this new groundbreaking medication. It's called Dostarlimab.
Okay.
Mm-hmm.
And what is this medication used for?
So it's used for endometrial cancer, recurrent or severe, along with solid tumors, recurrent or severe, that have a deficiency in the mismatch repair.
And so how does this medication work?
Okay, this is the mechanism of action for Dostarlimab, better known as Jemperli. And we'll start off with cancer and programmed death ligands, or PDL1 and 2, and what they are. So programmed death ligand 1 and 2 are expressed on somatic cells across the body. PD1 is the receptor that's expressed on T cells for those ligands. So we have the ligands that are expressed on somatic cells and cancerous cells, but then we also have the receptors for those ligands on our T cells. So in non-cancerous cells, programmed death ligand 1 and 2 help maintain normal immune homeostasis. And this deactivates immune cells and prevent the initiation of programmed cell death of normal functioning cells, which is good because we don't want our normal cells to be destroyed by our T cells. And we want our T cells to recognize our cells, our own cells, and deactivate or destroy cancerous cells. But the problem comes when cancerous cells express the same ligands as our normal cells, and it deactivates our T cells. So in cancerous cells, such as endometriosis, activated T cells release interferon gamma, which increases PDL1 expression in cancerous cells, but they also increase them in other cells, which ultimately deactivates the T cells and their cytotoxic capabilities, allowing cancer to proliferate. This is where Dostarlimab, or Jemperli, comes into play. It's a humanized monoclonal antibody of the IgG4 isotype that binds to PD1 receptors and blocks its interaction with PDL1 and PDL2. So it's a programmed death receptor 1 blocking antibody that works by binding PD1 to block interactions between PD1 and PDL1 and 2. This releases PD1 pathway mediated inhibition of the anti-tumor response to kill cancer cells, which is an amazing drug. We studied monoclonal antibodies before. They're popping up everywhere, and this is another instance of that case. So on your left, you see inhibited T cells, and on your right, you see activated T cells with Dostarlimab. This is an example of how this monoclonal antibody works, which is a very good example, actually. I think is simplified enough to just make this point really quick. There's other processes that happen. There's other receptors that also have to bind, but for simplicity, this is what's happening. The mechanism of action is what's happening here. So on the left side, you see cancer cells can increase expression of the PDL1 on their surface, which binds to PD1 on T cells. Like I mentioned before, T cells release the interferon gamma, which increases PDL1 expression in those tumor cells, which makes it even more susceptible to not being attacked by our own T cells, which allows those tumor cells to proliferate. That's a bad thing. So if you look on the right side of the screen, activated T cell, I'm not sure if you can see my mouse here, but here's the monoclonal antibody, Dostarlimab, and activated T cells with Dostarlimab here blocks that PD1 and PDL1 and L2. It doesn't say L2 here, but it's blocking that PDL2 receptor or ligand, as well. And this enables the T cell to identify and attack cancer cells by restoring the cytotoxic activity in the T cells. I left a link here at the bottom, which gives a better detailed depiction of what's happening. And it's an amazing video. You should check it out. But that is the mechanism of action of Dostarlimab. Thank you.
So what are the side effects?
So I have them listed on the back of my sign, so if you can help me turn this forward, then I'll be able to show you. So as you can see listed on this board, these are some of the main common side effects. These include skin rash, UTI, diarrhea, nausea, constipation, fatigue, along with the cough and fever. But on the bright side, there are no contraindications to this medication.
Okay, let's do it. Is there anything else I need to know about this drug?
Hi there, my name is Jasmine and I'm a PA, and I will be telling you a little bit about Dostarlimab and their special considerations. So some special considerations is that they are normally immune-mediated endocrinopathies associated with this medication. These include diabetes, adrenal insufficiency, thyroid disorders, GI toxicity, and among many other things. If a patient is planning to become pregnant, they should use effective contraception during therapy for about 4 months after the last dose of Dostarlimab. Additionally, there was a very interesting study done that had pertaining to this medication that had 12 patients, all with advanced rectal cancer, and they were given Dostarlimab every 3 weeks for 6 months, and within a year, every patient saw that their cancer disappeared. So there will be a short video at the end of this clip just explaining a little bit more about that study done and a little bit more about the medication.
12 cancer patients, 1 experimental treatment, an astonishing result.
That day, I didn't see the tumor. Maybe I thought it's hiding somewhere inside. The doctor told me, there is no more tumor. It's a miracle.
In a tiny clinical trial in New York, the small group of patients with advanced rectal cancer and a specific mutation received the drug Dostarlimab, administered every 3 weeks for 6 months.
It completely eliminated the cancer. The tumors just vanished.
Within a year of the trial, every single patient saw their cancer disappear.
It's absolutely incredible. We didn't expect it. It's really what, cancer doctors' dreams are made of.
You expect that it might work in a percentage of patients. You'd be pretty happy if it worked in half of them. But to see it work in all of them, albeit it's a very small number, that is something very unusual.
Dostarlimab is an antibody drug that is already used to treat endometrial cancer, but it's the first time it's been trialled against rectal cancer tumours. None of the patients experienced significant side effects.